Welcome to ACES Dental, a clinical assistant quick guide for pre appointment preparation. Our motto is to stress less and smile more. So don't forget to enjoy your time at work at ACES. Please note every employee has a written list of responsibilities and has access to all employee rights. Information about this is available through posters in your break room and common areas and is also a part of your contract and your employee handbook. Access to employee handbook is available online through Cedar Solutions. Please feel free to contact your supervisor or your manager to gain access if you have not already done so. Let's start. Every backstaff employee has to have a current basic life support certification. The backstaff employee should be able to take x-rays proficiently, should be compliant with HIPAA and OSHA, and has to be able to self-learn and be accountable for their own actions. Due to the pandemic, we have currently suspended all in-office training, and any training available has to be accessed by the employee through online portals. Let's start with tooth numbering. At our offices, we follow two types of tooth numbering systems. First is the one that's followed by our general dentists. They use numbers 1 to 32 to identify permanent teeth and alphabets A to T to identify primary teeth. You will need this information while filling out treatment plans as dictated by the doctor. The second kind of tooth numbering that we use is the orthodontic tooth numbering. It starts with 1 and ends with the number 8. To find out which quadrant the orthodontist is talking about, the orthodontist will typically say UR1. U stands for upper, R stands for right, and 1 is the number of the tooth. So UR1 is upper right central incisor. For primary teeth, orthodontists use only 5 alphabets, A to E. Again, the orthodontist will describe the quadrant using letters such as UR for upper right, UL for upper left, LL for lower left, and LR for lower right, and then state the alphabet. For example, ULA stands for upper left central incisor. Please make sure you are familiar with both systems so you can be a proficient backstaff assistant to both our general dentists and our orthodontists. Charting of teeth will be extremely important while writing down treatment plans. The ACES Dental Treatment Plan looks like the document on your screen. Please enter the patient's name, date, the name of the doctor, and your name on this form. Write down the purpose of the appointment. For example, if it's a new patient exam, write NPA. If it's an emergency, write emergency. If it is a perio cleaning, then write perio cleaning. Enter the other relevant information in the area provided. The doctor will ask you to mark the cavities that need to be filled on the tooth chart. Please ensure that you know how to write this information down. Additional notes can be written at the bottom. This information will then be given to the biller so that consent can be obtained from the patient and treatment can begin. We use a lot of short forms or acronyms in dentistry. The common dental and orthodontic acronyms are listed on your screen. Please make sure you are familiar with this because acronyms allow you to write treatment plans briefly and in a concise manner on the treatment plan form. COVID-19 patient protocol has been implemented at all ACES dental offices. Please be aware of the changes that have taken place. And most importantly, Please be aware that these changes help keep both our patient and our employees safe from the spread of the dangerous disease. We have instituted the ACEs protocol for every patient that comes to our office. The back staff assistant has to follow this ACEs protocol for every patient that they see. A in the ACEs stands for access to patient chart. C, call patient. E, explain to patient. And S, safety measures information. Let's go over it together. Prior to a patient being seated in the op, read the patient's chart, review the health history, look for any red flags on health history or on financials that the office manager or the biller may have posted. You want to keep an eye out for things like latex allergies, in which case you will automatically remove all latex gloves and replace them with nitrile gloves and remind the doctor about the allergy. Also, for any female, you must ask the history of pregnancy. This can be tricky and people may get offended, so please start off apologetically and ask the patient. For example, "I'm so sorry, ma'am, but I have to ask you this for legal reasons. Are you taking any oral contraceptive pills, or are you pregnant at the moment? Or do you think you're going to be pregnant?" If the patient answers yes, note it down in the chart and inform the doctor immediately. Do not take any x-rays. Every patient must have a sticky note with their name, the name of the insurance, and the procedure that they are scheduled for. Next, call the patient and seat the patient in the office. This is when you will be asking for the history of pregnancy or health conditions and so on and so forth. Please make sure you also engage in small talk with the patient, as this eases the patient and makes them more comfortable. Next, explain what the appointment today is for. For example, "Hello, Mrs. Smith. My name is Angie. I'm going to be taking care of you today. Your appointment today is for a cleaning. I'm going to take some x-rays to begin with, and then the doctor will evaluate the x-rays, talk to you, and then do the cleaning. Did you have any questions? Have you had any changes in your health history? Are you pregnant or taking any oral contraceptive pills at the moment? Have you started or stopped any medications since the last time we saw you?" These are all normal questions that every dental assistant must ask patients. Last but not the least, because of COVID, there is a final step that has been added to the patient protocol. Every backstaff assistant has to briefly go over the safety measures taken at the office to mitigate the spread of COVID-19. For example, explain to the patient, "Dear Mrs. Smith, we're so glad to have you back. As you can see, we've had many changes in the office because of COVID. You will notice we are suited up a lot more. This is to protect you and avoid any spread of infection. I'm going to ask you to rinse your mouth with this antibacterial rinse, which also helps kill any virus particles that may be in the environment. Please don't be surprised at the way we look today. I know you're not used to having face shields, but these are new regulations that have been implemented for your safety.